Hey there, everyone. So today I have a patient here who complains of some back pain, some muscle tightness. We'll get into the interview right now, but what she has is spondylolisthesis, pretty much a slippage of the vertebrae around L4, L5. And one of the things we want to avoid is extension exercises. So I'm gonna get started with the interview, and we'll see what patient presents, what kind of symptoms, what kind of pain, and all that. So let's get started. Hello.
Hi.
My name is Adrian. I'm going to be your student physical therapist assistant today. Okay. Before we get started, do I have permission to assess and treat you by touch?
Yes.
Okay. So a couple questions. How are you feeling? What's going on?
I'm okay. My back's a little uncomfortable.
Okay. Can you tell me where on your back?
My lower back and then kind of towards the bottom.
Towards the bottom?
Yeah.
Okay. How would you describe that pain?
On a scale?
Just like dull, aching, tightness. What kind of pain is it?
I'd say more dull, not
Okay.
too sharp.
Okay.
Yeah.
And on a scale of 0 to 10, how bad is it?
I'd say like a 4.
A 4.
Mhm.
Okay. I saw on your charts that you played tennis before, so
Mhm.
I know that's kind of one of your goals. You want to get back to.
Yeah. I just want to get back to my main skill and be comfortable with what I'm doing.
Okay. And she's been coming to PT for quite a while, for about 3 weeks. She has seen an improvement in her pain.
Mhm.
So we'll just get started. But one thing I would like for her to ask is there anything, is there anything that helps you alleviate the pain, like as far as how you sleep, or do you take longer rest periods?
Well, if I'm lying down to sleep, keeping my knees bent helps a lot to
Okay.
just kind of straighten out my back.
Okay.
Like if I'm standing, keep my knees just a little bit, my knees or my hips slightly tucked also, because I don't want it too curved in the back, I guess.
Okay. All right. So pretty much, I got the interview going, and first thing I would like for us to do is get a hot pack. We can use hot pack or either a TENS unit to alleviate some of that pain and stretch out some of the spinal muscles along the lumbar region. And so what we're going to do is just put a heat and TENS pack for about 10 minutes, and then we could get started in the intervention. So one of the first exercises that I'm going to perform and show her is the bridge exercise. And what the bridge exercise consists of is understanding how to position yourself, but you want to kind of use your legs and all your hamstrings and quads are firing. And so you could go ahead and perform the bridge. Go ahead and perform that for me. And I'll be looking for some cues. I'm going to be cueing her to see if her hips drop. So I don't want to see any of her hips tilting. Kind of want to keep the ASIS even. So we can put like a dowel or a stick here to help maintain the balance in the hips. So go ahead and bridge for me, okay? So you're going to go ahead and push down. There you go. And we're going to do a couple of these. She can hold it for 5 seconds up top and come down slowly. Okay, you feel that? I want you to feel all this firing. You're going to have a co-contraction of your quads, your hamstrings. Kind of push down onto your heels is another thing I would be cueing her on. So I'll probably do 2 sets of 15. It could be 3 sets of 10. Depending on how my patient is feeling. How are you feeling?
Okay.
Okay, so she's doing okay. And so go ahead and just kind of finish that up. So when she kind of masters the bridge, we could get into a single leg raise. So single leg raise is going to pretty much be the same thing, but it's going to be a progression in which we try to maintain the same stability. And also, we want to keep our core tight. Trying to keep our hips neutral, core tight. We're going to push down, and we're going to raise this leg up. Okay. Okay. So we're gonna go ahead and do those single leg raises on each side. And same thing, we want to look for those imbalances, looking for to see if she's performing them correctly or not. That's a little too high. You just kind of want to keep it levels from the floor up to your knees. Okay, there you go. And she can maintain the hold up for 5 seconds. There you go. So maintain that right there.
Oh, here?
Yeah, but that's a little too high. There, that's fine.
Okay.
Okay, and then she can go down. So we're holding and relaxing. Do another set of 10. Reps of 10. You go ahead and relax. Okay. She can also do some dead bugs. So dead bugs will have us in a position like this. Oh, if you can see. Kind of want to be here. Slide over a little bit. And we're going to go opposite side. And we want to pull in with our core right back to that neutral position. We want to keep the maintenance of the isometric contraction of the core, but also we're also eccentrically loading and then concentrically coming back. So we'll go ahead and perform that. And we call those dead bugs. If this is too difficult, you can go ahead and perform it. We'll get into the progression. So go ahead and bend your knees. So, yeah, exactly. So put your hands up the way I had them, yeah. So you're gonna go out, yep, and pull back in, perfect. Now we wanna look for any compensations like around her back, so kind of flatten it out if you can, that's fine. And we wanna maintain the core strength over here, okay. If this is too difficult, we can always place the feet down and she could just do her hands. And she's going to be pulling with her core, with her rectus abdominis. Go ahead. A little ticklish there?
Yeah.
Okay. Or if she's advanced, go ahead and put your legs up.
Straight?
Yep, just the way that we started. If she's advanced, we could go ahead and provide some resistance. So go ahead and pull out. And I can put some manual resistance to the exercise. There you go, and pull in, good. And again, or I can do some perturbations. And I can kind of push her while she's maintaining this position right here. There you go. It's a little difficult on her, but she's getting the things that she needs. Now we could do marches in that position as well. So we could do some marches. Pretty much the same thing. Kind of like a regression. Instead of having all 4 limbs up, we kind of just have the arms down, and we can kind of just touch and come right back. Touch and come right back. Our hip flexors are working. Our core is working. Our transverse abdominis is working. Okay. And we still want to make sure that she doesn't go into a full extension because we don't want to see the slippage of the vertebrae in her lumbar region. Okay, go ahead and perform those for me. And again, we can probably do, depending on the patient, she's doing okay. How are you feeling? Okay. Okay. So she's performing these with quite ease. And we can still do one set of 10 is fine. Okay. So not only are we kind of we're working a lot of muscles in the core area, around the hip. We could work on some hamstring exercises, some hip flexor exercises, some adductor exercises, some abductor muscle exercises. So we could get into some clams to also strengthen pretty much all the muscles around the hip area. So we're going to do some clams to work the glute med, some of the TFL. This is going to help her hips stay in line. We do a little bit of clams, okay? And you hold it and come back. Hold it and slowly come back. We still want to keep the eccentric contraction of the glute med and any of the abductors. Okay, go ahead and perform that. All right. And you can increase the resistant band resistance. This one we're starting with ease. This red band is pretty easy to perform. This is a good band to if your patient is progressing fine in their clams. This red band does the job to progress. Okay. We could do hamstring exercises after this, okay? So we could do some heel slides, some towel heel slides. We do, that's fine. Yeah. We could just kind of just do some heel slides, you know? Pretty much have you in this position and kind of just slide your heel like this, right? And kind of just go back and slide your heel. And you could do switch both sides. Right, eccentrically control. Now if you want to progress, you can also have like an isometric on one side, pushing down, still firing the hamstring, and pulling the other. You kind of switch off. Make sure toes are up so you can fire the hamstrings in the back. Okay, so go ahead and perform that. Once she's done with this exercise, I think that would be enough for this patient. You know, it can take about 30 minutes, 40 minutes to complete a full program. But she's progressing fine. I'll be asking her questions along the way. Was there any exercises that you had any trouble with?
The single leg raise.
The single leg raise. So the single leg raise gave her some trouble. It could indicate that, did you have any pain?
No.
No, she didn't have any pain. So it was kind of hard because it can be very difficult to, you know, have that strength and the stability behind the mechanics of that exercise. But since she's there, I can just perform some stretches. So go ahead and just lay down. I'm going to just do some hamstring stretches. So I'm going to come here. Make sure that she's not in pain. So I'll be asking her, hey, are you feeling anything? You okay? Okay. Make sure that she doesn't really have too much like resistance behind the hamstring. Okay. Start feeling where the rope is feeling taut and kind of just work. I can perform some PNF. She can go ahead and push against my hand. Push, 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 push. Relax. I can take her into a further range. Look at that. So you got about like 15 degrees just off doing that. And go ahead and push again. Push, 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 push. And go ahead and relax. And I could get into a further stretch. There you go. So we can do that on both sides. I can have her do a single leg to chest exercise. Oh, you like this, huh? You feeling okay?
Yeah, I'm good.
Okay. So I can come here, stretch the hamstring, stretch some of the lumbar fascia in the back. Okay. Or we can do a double leg. So double knees to chest. So go ahead and bring your other knee. So I can come here and perform the stretch for her. I want her to get full range and back. Okay? I can do that, or I can have her do it on herself, since we're gonna have her hand her the home exercise program, and you can go ahead and pull in your legs. So pull in your legs, and you can hold that. I could have her hold that, and I can hold here. But I could teach her how to do this, and she could perform these at home. Okay, we want to still maintain a neutral or flex the spine. There's no issue with that with spondylolisthesis, and we can do some QL exercise stretches. So go ahead and bend your knees. Right here, that's fine. And we're just gonna go side to side, okay? We want to do it slowly, but the patient is warm, so we can perform those, and we're gonna stretch the QL, okay? Some of the glute max stuff, a little bit of the deeper muscles in the lumbar region, and from here, patient is ready to get going. We ask her if she would like ice or not. Some patients say no, some patients say yeah. So what would you like? Would you like some ice?
I'm good, thank you.
Okay, so she doesn't want ice, but I would recommend some ice because, you know, the muscles are worked. So we kind of want to put that ice, and this definitely makes the patient feel much better after. And there it is. Thank you guys so much.